it's a new year. Is starting to exercise one of your New Year's resolutions? For seniors over 60, there are wonderful advantages to exercise. However, did you know that there are precautions to consider before beginning an exercise regimen? Here to talk about exercise over 60, precautions and benefits is Baptist Medical Group and Andrews Institute orthopedic trauma and fracture care physician, Dr. Leslie Barnes Remski. Good morning, Dr. Remski. Thank you so much for coming on the show.
Thank you for having me.
Well, to get us started, tell us a little bit about yourself and how you became an orthopedic trauma and fracture care physician.
Well, I was born and raised in Canada, but I did all of my medical education in the United States, beginning with medical school in Detroit, Michigan, followed by orthopedic surgery residency in Shreveport, Louisiana, and then an orthopedic trauma fellowship at University of Alabama in Birmingham, before I started my practice here as an orthopedic trauma and a fracture care specialist with Baptist Andrews. I'm
so glad you can say that, because it certainly is a mouthful, so you must be pretty important.
Just a lot of practice, yes.
But I'm sure many of our viewers are kind of in an exercise routine, but can you tell us what are some of the benefits of exercising as a senior, maybe 60 and older?
There are so many benefits to it. As we age, our bones get weaker just as a natural process, so daily exercise can strengthen your muscles and your bones, can improve your balance to stability and decrease falls. It has a great effect on mood, decreases depression. It can improve your sleep and also just improve the way you do all the activities of your life. If you want to play with your grandchildren or climb stairs, getting up and down, even out of chairs. For people who are sitting most of the time, your muscles will get weaker, and exercise can improve just the way you function in your life to make aging more successful and more productive.
Well, and it sounds like those benefits not only apply to seniors, but pretty much anyone.
That's true.
But if someone is at the age of 60 or older, a senior, what can they do to get started if maybe they're not familiar with an exercise routine? Exactly.
It's a great way to just start changing your activity level and start changing your life and improving it. The first thing, you should always talk to your doctor. If you have any kind of new symptoms or symptoms that you've never discussed with your doctor, such as dizziness, shortness of breath, chest pain, or even the sensation of your heart fluttering, these should be evaluated before you start any new program. After that, it's really about safety. You don't have to get complicated or use any significant or special equipment, but you should have comfortable clothing, stable, comfortable shoes, and find something that you enjoy doing. If it becomes a chore, you really won't want to do it. Another thing that can be very helpful is to get an exercise buddy. Somebody that you can exercise with. It's great for safety if you're walking outside, keeping an eye out for each other, as well as just for motivation and having fun with it. So a lot of different things you can do, and find something that starts simple. It can be as little as 5 minutes a day if you're not used to doing anything, and go up to more than 30 minutes a day, and you'll see the benefits.
I like the idea of bringing along a buddy, because I know that it helps with my accountability.
Yes.
But we also, as you mentioned, there are several benefits. We know that it also helps with your bones. Can you tell us a little bit about strength training?
Okay, so there's both strength training and through resistance exercises, as well as weight-bearing exercises. Your muscles respond to exercise and stress by building up and getting stronger. Your bones actually do the same thing. So weight-bearing exercises like walking, running, playing tennis, or dancing all work your body simply against gravity, and your bones respond to that and increase their bone density. The goal is ideally to avoid any injuries or fractures that can occur because of our decreasing bone density over time. And that is what's called a fragility fracture. Any fracture that occurs from simply walking and falling from a standing height or less, or even from any minor injury that wouldn't even be considered a trauma, such as twisting injuries. If your bones break with those, you probably have osteoporosis and should be evaluated for that.
Well, and then of course that segues perfectly into the next question, which is, how do you treat and diagnose those fragility fractures?
Well, the fractures themselves usually happen after some kind of fall or something that causes an increase in pain. So people either present to the emergency room or an urgent care center for an x-ray, and they're diagnosed on x-ray. There are 4 common areas that fragility fractures happen: the shoulder, the wrist, and the 2 most common, the spine and the hip. The spine and the hip are often the most debilitating, can change your lifestyle and decrease your independence significantly. So it's so important to treat osteoporosis early so that you can avoid these major fractures. So they're diagnosed with an x-ray, and then either surgical or non-surgical treatment can be done depending on the kind of fracture and where it's located. The hip is almost always treated with surgery. The other areas can go both ways depending on the fracture. And then after that, you need to treat the cause of it, which is the osteoporosis or the low mineral density. A DEXA scan or bone mineral density scan can diagnose that for you. And then you can also test your vitamin D and your calcium to make sure you have appropriate supplementation.
Perfect. A lot of great information. So tell us, what best advice would you give someone considered a senior that would be interested in kind of getting more exercise in their lives?
Well, I really want everybody to know that it's never too old. You're never too old, and it's never too late to
Right.
start an exercise program. You need to make it a priority in your life. It has to be part of your regular routine, but it should be fun. It shouldn't be a chore, again.
Exercise fun?
Yes.
Exercise can be fun? I can't believe
It can be fun. So whether it's dancing, I love ballroom dancing myself, or running, something that gets you outside, all of these things can help you improve your independence, regain independence that maybe you've lost. A lot of times people retire and they're just so used to that regular routine that it can really affect their mood. And you'll notice a real difference if you get up and get active, get involved in the community. There's a lot of ways to get involved and actually participate in something that gets you moving, but also enhances other people's lives as well.
Absolutely.
So stress your body a little bit. You'll be surprised at what it can do for you.
Great stuff. Well, in closing, I'm sure our viewers will want more information on this. Of course, it's a lot of great information. So what resources are available? Who can they call?
Well, they can go to our website at andrewsinstitute.com, or again, talk to your primary care physician about ways to start exercising to make sure that you're doing it in a safe manner and all of your medical issues are addressed. And then, if you have an injury or want to be seen in our clinic, please give us a call. My partners and I are more than willing to address any orthopedic issues.
Thank you so much for coming on the show this morning.
Thank you for having me. It's been a pleasure.